So your Medicare plan is going to change this year. In 2025, I think there are going to be some massive updates coming to the whole Medicare system that I think whether you have a Medicare Advantage plan or a Medicare supplement is going to affect you in some specific way. So I'm going to talk about 4 ways in this video that I think Medicare Advantage is going to change and 2 ways that I believe Medicare supplements are going to change. So either way you have it, it's not going to be general changes to your plan. I think there are going to be some very specific ways based on what we've seen, based on some federal legislation like the Inflation Reduction Act. There's been articles that have come out in Newsweek magazine. So no matter where you're at, whether you have Medicare Advantage or Medicare Supplement, I want you to stick around in this video because by the end, I'm going to tell you how you specifically can prepare for these changes and why it's important to you. So let's take a look at it. So first, let's start with Medicare Advantage. I think there are 4 major ways that Medicare Advantage plans are going to change in 2025. And the main reason is it's because of the Inflation Reduction Act. And if you're not familiar with the Inflation Reduction Act it's an act that was passed by the Biden administration in 2022 that's really starting to ramp up here. And in 2025, the main thing as far as Medicare is concerned is they wanted to pass it so that they capped prescription drug costs at $2,000 per member for everyone across the board. Doesn't matter who it is, but there are a lot of people out there that are paying tens of thousands of dollars. I mean, $5,000, $8,000, $10,000 for their high-cost prescription medications. So this is a massive win for everybody that has these types of costs in their plan. So what the Biden administration did was they capped it so that these people can, afford to pay their prescription drug costs now. And what that means for a lot of people is that they're going to save a ton of money. But remember, somebody's got to pay for that. And this might be just my opinion, but I think we've seen it with inflation rising over the past few years anyway. I think it's just kind of a universal truth. That money's going to get paid for somewhere. So for instance, if you're somebody and you're paying $8,000 for your prescription drug costs or $5,000 for your prescription drug costs, and the federal government caps it at $2,000, the difference between 8 and 2 is $6,000. So my question is, who's paying for that? It's not going to be the president. It's not going to be the federal government. They're not going to pay for it. The insurance company's not going to pay for it. So I fully believe with all of my heart that that's going to be passed along to every single member of a Medicare Advantage plan or a prescription drug plan. Remember, Medicare Advantage is Medicare Part C. It's part of the federal government program. Medicare prescription drug plans are Medicare Part D, part of the federal program. When the federal government does something that reduces costs, somebody's going to have to pay for it. So that's kind of the point here of why I think Medicare Advantage plans are going to change and why Medicare prescription drug plans are going to change. So whether you have Medicare Advantage or Medicare Supplement, something's about to change for you. So let's get into Medicare Advantage changes. Number 1, I think we're going to see coming down the pike. And by the way, I want to say, this might be, it's not conjecture at this point. I've kind of gone behind the curtain and talked to some of the carriers and some of these things. We can't guarantee these things are going to happen, but these are the things that I'm going to predict that are going to happen based on some of the people and players in the industry that I'm talking to. I think most Medicare Advantage plans are going to see a change like this, depending on where you live, because Medicare Advantage plans are zip code and county and location dependent. So some areas have better Medicare Advantage plans than the other. Here where I am in the Metro Detroit area, we have some phenomenal Medicare Advantage plans available to us. They're not for everybody, and there's a lot of Medicare supplement plans in the area, but some places are better than others when it comes to Medicare Advantage plans. But regardless, if you have a $0 Medicare Advantage plan, you could see a premium on that $0. I don't anticipate that, but that could be a possibility. And all of these things, by the way, are just to help prepare you, right? So just brace for this. Maybe prepare for it. Prepare financially. I want to tell you this months ahead of time so you have time to prepare for it. So one of the things that I do think you're going to see is a lot of these Medicare Advantage plans don't come with a Medicare drug deductible. So they have a $0 premium, a $0 drug deductible, things like that. I think you're going to see some drug deductibles. I think they're going to pass on that cost savings from these high cost medications in the form of prescription drug deductibles. I also think in addition to maybe some drug deductibles coming on, or maybe even a premium, you're going to see a decrease in supplemental benefits. Now, we all know, we've all seen the commercials, we've all seen the Joe Namath on TV and all the ads for all these Medicare Advantage plans. What do you see? They're all out benefiting each other. They're all saying, hey, come because we have this dental, or we have this grocery card, or we have this benefit. All of these benefits are to play off of your emotions of fear of loss. What can I get? Fear of missing out, all of those emotions. But I think some of those supplemental benefits that all of these companies are trying to outcompete each other for your business, for your membership, I think some of those are going to get cut. Things like dental, things like vision, things like over-the-counter cards, a lot of these, maybe these flex cards or these grocery cards that you see, all of these extra benefits. When I sit down with a client, when the number one thing we talk about when we're talking about a Medicare Advantage plan, we talk about medical and we talk about hospital. We talk about prescription drugs because that's what Medicare is for. It's for your medical benefits. It's for your prescription, the lowest prescription drug cost. So when we do the analysis, you're going to have a very wide network of doctors. You're going to have, I'm talking about Medicare Advantage plans, you're going to have a wide network of doctors. You're going to have great benefits as far as medical benefits and specialists and prescription drug costs. All of the extra benefits are exactly what I just said. They're extra benefits. They're not designed and geared to be the end-all say-all. So I always tell people, don't go for the shiny object syndrome. Don't go for the shiny stuff. Those supplemental benefits, the dental, the vision, the over-the-counter, the grocery cards, the gym memberships, the fitness, all of those things, because exactly what I think is going to happen in 25 is those benefits can be taken away in a heartbeat, just like that. So those can go away. So I think number two, you're going to see a decrease in supplemental benefits. Another thing that I think you're going to see cut or reduced is benefits that look good, but don't get used very often. I'm talking about things in Medicare Advantage plans that are like companion care. Things that are wonderful when you look at them on paper in the summary of benefits. You see companion care, you see all these little extra things. That's different than supplemental benefits, but something like companion care where you can come in and get respite care, or if you're taking care of a loved one, somebody can come in and sit with them while you kind of get a break, or you just get some rest or do whatever you need to do because you're taking care of somebody else. I think some of these things, even though they're wonderful and they serve a ton of people, a lot of people don't use them. So I think all the insurance companies, or I can imagine that the Medicare Advantage plans, they're going to look at what gets utilized. And if it doesn't get utilized, if this is a great benefit, but it's really underutilized, I think that's a supplemental benefit that you're going to see drastically either reduced or cut. And I think one of the last things you're going to see, number 4, in Medicare Advantage plans that I want you to prepare for is I think that your cost sharing in these plans is going to increase. And what does that translate to? Copays. I think you're going to have higher copays. I think some of these doctor visits, primary care that's $0 might be $10 now. Maybe specialists that used to be $35 might be $45. I think some of these hospital outpatient surgery, inpatient hospital copays, all of these copays, I think you're going to see cost sharing increase. Again, if the federal government is saving millions and millions of dollars for people somewhere, somebody else is going to pay for it. So I think incrementally as these copays get increased, they're going to pass on those savings to you. So let's recap Medicare Advantage. I think you're going to see prescription drug plan deductibles. I think you're going to see a decrease in supplemental benefits. I think you're going to see benefits like companion care, things like that look good but don't get used often. I think you're going to see those get reduced. And I also think you're going to see a higher cost sharing as far as copays and things like that. I think ultimately, let me just boil it down here. I think Medicare Advantage plans are going to they're going to revert back to the mean. They're going to revert back to what they were supposed to be in the beginning. They're going to go back to healthcare and prescription drug costs. So over the years, like I've already mentioned, they have gotten so blown out of proportion with all these extra benefits and these companies out competing each other. I think you're going to go back to, they're going to just tighten it up a little bit, right? They're going to tighten it up to be what they were originally designed to do. They're going to be excellent healthcare. They're going to keep, I think they're going to keep the same large networks depending on your area. Again, I keep saying that, but I want you to, if you have a personal agent or if you have questions, please, I'm going to put our info down on the screen. Please feel free to reach out to us. Let us know what area you're in because Medicare Advantage plans depend on the area. Like I said, here we have some tremendous plans. In Michigan, I think the ratio is like 60% Medicare Advantage plans. It's not all about Medicare Advantage plans. Medicare supplements are amazing, but I always say whatever your heart gravitates to, go with that. If it's Medicare Advantage, great. If it's Medicare Supplement, great. But make sure you do the research because in your area, these might not be the best option for you. Medicare Advantage might not be the best option. It might be a terrible option for you. So the point is just do your research, talk to an independent an independent agent that does not care what plan you go with. Let's go over to Medicare supplements now, because I think there's two ways that people on Medicare supplements or Medigap are going to be affected by this as well. Because I think, again, this is a holistic thing that's going to affect everybody. So everybody on a Medicare supplement plan, or most people on a Medicare supplement plan or Medigap, are going to have a standalone prescription drug plan. You're going to have Medicare Part D. So at some level, because Medigap does not come with Medicare Part D, you have to add on a standalone prescription drug plan. So what I think and what I predict when it comes to this Inflation Reduction Act and some of the cutting back and the passing on of cost to you, I think that you're gonna see Medicare supplement companies who also deal in the prescription drug plan space. Not every Medicare supplement plan does that, but there are certain insurance carriers that offer Medicare supplement plans and they offer prescription drug plans, same exact company. So I think those companies who deal with prescription drug plans, I think you're going to see those plans increase. I think they're going to pass along that savings by either higher premiums, again, higher deductibles, higher copays, things like that. So the point of that is, no matter which side you're on, going back to Medicare Advantage or Medicare Supplement, I want you to please do yourself a favor. Please take this advice. Do yourself a favor and have a comprehensive analysis every single year. Every single year during the annual enrollment period, October 15th to December 7th, you can make changes. You can reanalyze your plan. So if you have a Medigap plan or a Medicare supplement policy and you have a standalone prescription drug plan and that baby skyrockets, then if I were you, I would call an independent agent. Again, we're here for you if you want. You don't have to use us, use your person, but reach out to that agent and say, hey, can you do another analysis? Can you tell me, is this still the best plan for me this year in 2025? That's going to be a massive thing. You're going to want to do that on Medicare Advantage, or you're going to want to do that on Medicare supplements. Trust me. The second thing I think you're going to see is that if they do work in the prescription drug plan space, we're still talking about Medigap companies. If they work in the prescription drug plan space and they have a Medigap plan and a prescription drug plan, they may cancel that current prescription drug plan. They might just dissolve it altogether and start a new prescription drug plan. You've probably seen this if you've been on Medicare at all. You've seen some companies have Plan A or Plan XYZ. And then next year they don't have that plan anymore. You see Plan XYZ, they don't have that plan anymore, but they have this plan. They have Plan ABC. Same company, different plan. I think you might see that too. If they don't mess with the current plans, they're going to start a whole new plan. And then you're just going to see a much thinner formulary. You're going to see higher costs. You're going to see less drugs covered, and you'll probably see a higher premium. So no matter which way you look at it, I think you're going to see standalone prescription drug plans raise their costs, raise their deductibles, or get out of the space altogether, or start a new plan with thinner formularies and higher premiums. And then on the Medicare Advantage side, again, going back to that, I think you're going to see the four things we talked about. So either way, any way you look at it, I really believe that 2025 is kind of going to be a watershed year for Medicare in general, for Medicare beneficiaries in general. That's exactly why I'm doing this video. I want you to be prepared because I truly do care about you. I care about this space. I care about the people that I meet with as my own clients. I care about you watching this video. Please prepare for this. Please prepare for higher costs. Please prepare for the win of the federal government. And this is not a political statement. The win of the administration is, hey, we saved all this money for everybody. Oh my goodness, we're the heroes. But the same people that they're saving money for are the same people they're passing that cost onto. So they're taking from here and passing it on from here. And it's a wonderful play. It's an amazing play. It's never been done. It's historical. But just please prepare, because somebody's going to pay for it. And typically it's going to be you. You watch your Medicare premiums go up every year. You watch your some of these deductibles and copays already go up every year. Well, 2025 is going to be because of this Inflation Reduction Act. We've seen inflation all across the board. So just please remember, check your policy every year. Every year you should get an annual notice of change. You should get what benefits are changing. Sometime prior to October, September, early October, you're going to get a notice that's going to tell you what's changing in your plan. It's called the ANOC, A-N-O-C, the annual notice of change. please look at that document. It is one of the most important documents that you can get every year, whether you have a standalone drug plan or a Medicare Advantage plan. So I really hope this video was helpful for you. Please leave me a comment. Let me know what you expect. Let me know, you might be really upset about this. You might be grateful for this information. Let me know your thoughts in the comments. I want to know, which one of these things on Medicare Advantage side do you think is going to be the hardest hitting? What do you think my predictions are going to be? Do you think my predictions are going to come true? Do you think they're going to come true on the standalone prescription drug side on Medicare supplements? Either way, I would love to hear from you. If you have questions, please leave them in the comments. I answer every single question. I respond to every single comment. We're in this together. We're here together through this. There's a lot of great agents out there. There's a lot of great people out there, but we're doing this so that you can save the most money, so that you can be prepared, and that so you can know the exact plan that you need for your situation for this next upcoming 12 months. So we're in this together. I've got your back all along the way. Leave a comment. Thanks for watching, and we'll see you in the next video.